Hey judges, it's my checking in with video 2 for the holistic category, and I want to talk about my treatment plan for Jacqueline. She has a lot of inflammatory skin conditions, including acne, post-inflammatory erythema, melasma, and subtype 1 rosacea. We're going to be meeting weekly. All of the treatments are going to look pretty similar. They're all going to include a different type of exfoliation. I have 3 depending on what her skin needs and kind of where her tolerance is at. One is a really gentle hydrating papain enzyme. The other is a cleansing gel that includes lactic acid and kojic acid. And then the third is a 20% lactic acid peel, which I'm going to really work her skin up to before we perform that. All is going to include high frequency, which is going to create a plasma to kill C. acnes bacteria. I did decide not to do red or blue lights just because there's enough literature arguing that it can exacerbate melasma, so I'm just going to cut out the LED light therapy entirely. Cryotherapy will work to reduce inflammation and increase circulation in the skin, and then the albumin conditioning mask will be used in all treatments to repair that skin and give her skin the perfect balance of exfoliation and repair. As far as her home care routine, we're going to have a creamy cleanser, soothing toner. She's going to be on a really healing, hydrating moisturizer, a zinc oxide sunscreen to protect and calm the skin, a hydrator with some repairing ingredients in there as well. And then I'm going to slowly introduce 2 actives. One is an exfoliating serum with 2% salicylic acid and a derivative of azelaic acid. This is great for her non-inflamed and inflamed acne, her post-inflammatory erythema, and her redness from her subtype 1 rosacea. There's also a 2.5 benzoyl peroxide we'll slowly introduce as well, which will really help to oxygenate the follicle and kill C. acnes bacteria. I really want her thinking about that holistic approach and not using antibiotics, medications, really harsh prescription topicals for her acne and for her inflammatory conditions, and really just focusing on skincare. And of course, diet and lifestyle is important too. We did have a really in-depth conversation about her diet and lifestyle. She consumes a lot of dairy, which will be an opportunity. She has a biotin supplement I encourage her to remove. She is a picker, so I educated her on how picking can influence irritation and inflammation. So I'm really excited to show Jacqueline that a holistic approach will really be the long-term solution for her skin conditions.